What's on everyone's mind right now is the reopening of schools and having to make decisions now when they don't know what things are going to look like in late August or September. Can you talk a little bit about, what we know about COVID in children and how parents, we have a lot of parents that watch the show, how parents can make decisions about whether or not to send their kids back to school?
Okay, that's a critical question because it's on everybody's minds right now. So the way I look at it, I want to go to 40,000 feet and say, let's take a concept. And in my mind and the mind of people who are really care about this, like representatives in the American Academy of Pediatrics, who say the default position is that we should try to the best of our ability to get the children back to school and keep the schools open because of the considerable deleterious downstream ripple effect negative consequences of keeping the kids out of school. That's a default, but it really is going to depend on what the viral activity is in the place that you are right now. So there are some counties, we have 3,007 counties in the United States. Google it. I didn't know that.
I know that. That's good to know. All right.
And as a matter of fact, there are some counties where there's so little viral activity, you could just say, don't worry about it, go back to school. But there are others, and I think these are the ones that you're referring to, where there's enough activity where you got to make a choice. And the choice can either be, don't bring the kids back, or preferably bring them back in a way that is very, very geared towards guaranteeing their safety and their welfare and the safety and the welfare of the teachers. And that might be simple logistic things like spacing of desks, alternating schedules and cleaning down the classes, outside as much as you possibly can versus inside. There are creative ways of doing that. I think to say it's unidimensional is missing the point. To say we are going to open up schools in the United States or not. That doesn't make any sense because we're such a big, big country that things are going to be different in one region versus the other. But getting back to what I said, the default should be try as best as possible to get the children back to school.
Does it matter by age? We need to be more focused on our younger kids getting back to school because there may be less transmission. They don't really serve as a vector as opposed to some of the older kids.
Well, that's a good point. And we, there's not a lot of data, even though there's a lot of anecdotes. There's not a lot of data on the infection susceptibility of kids and how well or not they transmit to adults. That's the big question. We're doing a study at NIH that we started on May 1st called the HEROES study, which is human epidemiology, et cetera, looking at 6,000 people in 2,000 families to look at the incidence and the prevalence of infection in children, what the relationship between their infection and family members, do they transmit it to the family or does the family transmit it to them? What is the impact of having underlying asthma and underlying allergic conditions, et cetera? So there's an ongoing study that's going to answer the questions that you and I are asking, but we don't have an answer to.